Factory Studios in downtown Little Rock. This is Capitol View.
Welcome to Capitol View. I'm your host, Roby Brock. Thank you so much for joining us. One of the big issues this last legislative session was addressing Arkansas's maternal health crisis. And guess what? The legislature and the governor addressed it. So now what? I am sitting down with Dr. Nirvana Manning. She is chair of the UAMS Department of Obstetrics and Gynecology, and Ashely Bearden Campbell, executive director of Arkansans for Improving Maternal Health. Thank you both for being here.
No, thank you for having us.
Glad to have you both back. So I've had you both on before. All right, Nirvana, I'm going to start with you first. Okay. Dr. Manning, I know her personally, so I kind of call her Nirvana all the time.
Please
here.
Call me Nirvana.
What is the biggest thing that you think was passed in this legislative session that is going to help lower our maternal health negative statistics?
Well, you know, I think, the Healthy Moms, Healthy Babies Act that the governor kind of really helped institute, did tons of research on, was able to really take into a much more thoughtful way, I think is going to be a landmark kind of thing for our state.
Will it be the unbundling, or will it be the campaign for awareness?
I think it's got so many great things in it that was so thoughtfully driven. I think one of the biggest things is going to be the presumptive eligibility. We know that over 50% of all births in our state are Medicaid eligible. Yeah. Quite often they don't get care until their Medicaid is secured, which often delays care months for many patients. So with presumptive eligibility, they can get that care. Providers know that they will get reimbursed for those services, but most importantly, those patients can get care in the first trimester, which can just change the trajectory of that pregnancy tremendously.
Right. What do you think, Ashely? What was your takeaway from what do you think is the biggest singular thing that might happen that will make a difference?
I agree. I think it's presumptive eligibility. I think it's making sure that these moms that are kind of in a flux position don't fall through the cracks and have access to the care that they need. I mean, we know that when moms are getting the prenatal care that they need, that they're going to have better outcomes. And so I think that this sets them up for a much more positive and healthy pregnancy and postpartum journey.
Yeah. Tell me what both of you do from your positions of influence now that the legislation is enacted. There will still probably have to be some rules and regs fleshed out, but not a ton of stuff right there. It's now, let's put it in motion. So tell me how you'll put things in motion.
I think for me personally, it's going to be staying on top of the progress and making sure, like you said, that these things are implemented, that they have financial vehicles to fund them, and making sure that there's awareness around this. We recently released a Healthy Moms, Healthy Babies guide to really break down what this act does and make sure that moms have access to the resources that make sense to them. I mean, legislation can be really complicated, and so we really wanted to make sure that everybody understands exactly what this law does. And how it can benefit them.
Yeah, you stole one of my questions, Ashely. I was going to come to that a little bit later, but it's good. We're out there with it. So what about you?
And I think for us, we have kind of our tendrils into all the delivering hospitals in our state. So we want to make sure those CEOs, their providers, the people with boots on the ground understand what this means to them. UAMS, we have a ton of resources, so we can work on the billing and coding and kind of hopefully be able to give that to them in a package so that it's easily digestible and they can kind of hit the ground running and understand what these pieces of legislation will mean for their individual hospitals.
This question for both of y'all too. I mean, you guys have both worked on this stuff for years, and I've seen it really from the beginning. You know, I mean, I remember the very first meeting that kind of got organized to start this push several years ago. It was post-pandemic, but it's been a couple of years. Were you surprised at how much consensus there was for this and how easily it pushed? I'm not saying easily, but it pushed through without a lot of resistance.
I think the governor's leadership in this has been instrumental, honestly. I think she comes at it from a different point of view. She's got small children. She's a mother. I think she was able to, initially she took it out of general session the 1 year and wanted a much more thoughtful process and was able to get a ton of stakeholders and really make a thoughtful process going through. And so I really commend her for that.
Yeah, I mean, I think it's really exciting. Obviously, there have been folks like Dr. Manning that have been working on this for years, and I think that a really important part of this is that folks would not let this issue go. I mean, the news coverage from a year ago to now is exponentially larger, and so this is just a topic that advocates across the state refuse to let die. And I think that that helped build that consensus and also show the governor and our legislators that there is broad statewide support. And so seeing everybody come together in a bipartisan way, not making this a red or blue issue has been really, really amazing, and it's going to make our state truly
It wasn't
better.
even a male or female issue, to be honest with you. It was a huge amount of,
exactly
men
right.
supporting this as well. I was with Representative Aaron Pilkington on a panel this past week on healthcare, and I asked him what he was going to be pushing forward for in the next legislative session. He says he's still going to continue to push for this 12-month postpartum Medicaid care. Is that still needed?
So I do think it's still needed. Now, we are doing, we've got an earmark grant from Senator Bozeman that is addressing some of these issues separately. And one of the big pillars of that grant is a proactive postpartum call center. And so what we are going to do with that, one of the main questions is, do you have Medicaid and do you need help with re-enrollment into another insurance plan, whether it be Medicaid or something else? And so I think we are able to bridge that gap right now in the short term. I don't know how long that will last. And so we need them to have insurance in the long run. We need them to have insurance past the 60 days or the end of the month, which is when it lapses for Medicaid.
All right, you got a new help guide out you were talking about there. How do you distribute that? Where's it going to go?
Yes, so you can go to our website, aimforarkansas.com. We have an entire resource link where you can find our Healthy Moms, Healthy Babies guide, our New Moms guide, which helps moms navigate how to talk about issues that you're having throughout your pregnancy with your provider. And again, a really easy to understand way, little phrases that can just make you feel more comfortable with your doctor and things to bring up. And then we also have our breastfeeding resource guides. So we house them on our website, and then we bring them to all of the moms events, which is really exciting.
All right, there was a big announcement out of Bentonville yesterday. One of the big champions of this cause is Olivia Walton, and she announced that Heartland Forward, this Bentonville-based think and do tank, I gotta always put that in there, launched the Maternal and Child Health Center for Policy and Practice. What do you think, how do you see that plugging into this whole equation here?
I mean, I think they do such amazing work out of Heartland. I think what it will do is hopefully make all of these efforts more cohesive. I think there are so many different pockets and people doing. I hope that it will not only kind of make it cohesive, but give us data to know where we're missing the mark and where we need to put effort going forward.
So in the time that we've got left, what do you work on next? I mean, obviously implementation, big part of it, but you got to look at the statistics, and I don't know how frequently some of this stuff comes out. How quickly can you know that what you're doing is making a difference?
Well, it depends on what you're looking at. I think if you're looking at repeat rapid pregnancies, you can see it pretty quickly. If you're looking at maternal mortality, it's going to take a year or two to be able to see some of those differences. I think a lot of the bones of these projects have been put into place, which I'm so thankful for. I think now we need to follow through and not lose the momentum. I mean, like Ashely was saying, we're talking about this so much more now, which I'm so thankful for, but now we can't kind of put our foot off the pedal. We've got to see these things through and be able to see kind of the numbers improving.
Why don't you compliment that?
Yeah, no, I absolutely agree. I think it's definitely about implementation and measuring how these successes are going to combat the statistics that we've seen. I mean, I'm really excited to see in a year from now what the maternal mortality rates hopefully have decreased with people like doulas now being a part of the care team. I'm really excited and encouraged, and like you said, I think that there's so many folks working on these, working on this issue across the state, but there's not really been one comprehensive way for them to connect. And so I hope that this momentum just continues to climb, and that we can bring everybody across the state together to make sure that they have the resources they need for their community.
I think this coalition stays intact too, and in the next legislative session, if something needs to be tweaked or changed or dramatically done, which I can't think of what that would be, but I mean, if the statistics bear something out, I think you guys have got a pretty permanent, long-lasting coalition. Do you agree?
I agree.
Yeah.
100%.
All right. Well, it is Mother's Day, and I wish you both a happy Mother's Day. Thank you for being with us and sharing these stories and the success, and I wish you all the best going forward as well. I'm very proud of both of you. So.
Thanks, Robbie.
Thank you.
Thanks so much
We
for having
appreciate
us.
you.
All right.
Yes, absolutely.
All right.